Hey, all you cool cats and kittens. Today we are getting into chapter 21, which is the thorax and abdomen. So this one should be a pretty quick video for you overall. Now, the thorax and abdomen is the area underneath your neck to where your bottom of your belly is. More precisely, it includes really your everything inside your hips and pelvis, but not the actual hips and pelvis themselves. Now, the way you tell the difference between the thorax versus the abdomen is the thorax is everything that is covered by your ribs. So everything that has the ribs going around it, including your two false ribs at the very bottom, that's your thorax. So we talked about in chapter 20 how you have your thoracic spine. Well, thoracic means thorax. So the rib cage is everything that surrounds that. So thorax, right from here to here, and then the abdomen below that. Now, with the abdomen, you have most of your internal organs in your abdominal cavity. This is pretty much your entire digestive system, and really, say like your liver, your pancreas is kind of in there, but mostly it's going to be your intestines. And this is just covered by your abdominal muscles or your core muscles. Now, some injuries we can have. One of the most common injuries you'll see to the thorax is a rib fracture or a rib contusion. A fracture is a break. So this right here and this right here, those are rib fractures. A contusion is a bruise. So if you have a contusion, you just have a bruise. For these, the only real way you're going to get these is if you get blunt force trauma to them. I mean, if you maybe like say sneeze really, really bad, you could potentially pull a muscle, but you're not going to break a bone or you're not going to bruise yourself doing that. So these are primarily from contact injury. If you have an undisplaced rib fracture, this would typically not be seen in an x-ray. So if you just had a cracked rib, that potentially wouldn't show up at all. So if you have an undisplaced rib fracture, you can keep playing up to your pain tolerance. If the bone pokes out, so if it displaces, you do run the risk of, say, like puncturing a lung, having a collapsed lung, which would be a pneumothorax. But if it's not displaced, you can play to your pain tolerance. And like I said, if you fracture a rib and it goes inward, that can cause you to puncture your lung or tear some other muscles. Now, a couple other injuries you want to know about here. Your intercostal muscles are the muscles you have of respiration. So all the muscles that line the actual rib cage itself are your intercostal muscles. They allow your rib cage to expand and contract so that you can breathe in and breathe out. If you get hit in the ribs, or if you all of a sudden, do a torsion force where you twist, you can potentially strain one of those muscles. No real big issue, but it can make breathing painful. It's one of those things that you're going to be hard pressed to hurt yourself even more, but at the same time, it's going to be pretty painful. Now, abdominal muscle strains are very common for switch hitting baseball and softball players. If you switch hit, you are putting strain on both sides of your abdominal wall, both sides of your obliques, and that is going to potentially cause strains to occur. If you just hit, like say right-handed, you have a much less chance of injury because you're always turning your body the same way. So it essentially builds up strength where it's going to be very difficult to really injure that just from swinging. If you're swinging both left and right-handed, now you really don't give your body a chance to build up a dominance on one side, and you leave your abdominal muscles a little bit weaker, so you potentially have the the ability to really have a strained oblique muscle. Last one here is a solar plexus injury. So this is a picture right here of your solar plexus. And what it is essentially is just a big network of nerves that go in and all around your intestines. If you get a solar plexus injury, you are essentially getting punched right here. And if that happens, then you'll feel like you got the wind knocked out of you. So that's the main thing that would happen if you had a solar plexus injury. Lung injuries, now these are going to be really less common in non-football sports. It's still good to know these though. If you have a pneumothorax, that means you have a collapsed lung. If you have a hemothorax, that means that you are going to actually have, and I'll show it here. This is where you have a blood vessel tear that's in or around the lungs. So hemothorax is going to be a tear in a blood vessel. Pneumothorax is going to be a collapsed lung or a tear in the lung. And then traumatic asphyxia. If you are asphyxiated, you can't breathe. If you have traumatic asphyxia, that means essentially that you have crushed like your windpipe, or you have potentially really, I don't really want to say that you've had an asthma attack because that's not traumatic. So really it's just going to primarily be if you crush your windpipe. Either way, not a good thing. And then last thing here I want to talk about is hernias. So these are your soft tissue injuries that you would see primarily in the abdomen and groin area. You can see these up closer to the thorax. Now, you are going to have primarily 4 different types of hernias that you'll see most often. And those are these right here: inguinal, femoral, hiatal, and umbilical. If you have a hiatal hernia, that is right here. That's where a piece of your stomach actually pops through your diaphragm and up against your esophagus. This would really only give you problems with your stomach and digestive system. It's not really going to be a big muscular issue here. A femoral hernia is over here. This is where you're going to have a tear in your lower abdominal wall. And when you have a tear in your abdominal wall, what happens is your intestines come out. So they poke through that. An inguinal hernia, you would see that's a little bit elevated, but you can still get the appreciation of it. So your inguinal canal will not necessarily tear, but you have rings that surround your inguinal canal, and they'll loosen up, allowing for your intestines to come out through it. Typically, that's only going to be on your left side that'll happen. And then an umbilical hernia, this is very common in pregnant women, where you would actually get the abdominal walls to separate at your belly button, and that's where you would get the intestines pushing through. If you have an incisional or a ventral hernia, this is just a broad term meaning that you had some sort of surgery to your abdomen, and then the internal stitches broke open and allowed your intestines to push out. So that's just what an incisional hernia would be. So pretty quick one there, but that is everything we have on the thorax and the abdomen. And then we'll be finishing up here with primarily the head, and we will see you all then.